Gas exchange. Hi, this is Bill again, and the concept of it. The definition: gas exchange, the process by which oxygen is transported to cells and carbon dioxide is transported from the cells. This normal process requires interaction among the neurological, respiratory, and cardiovascular systems. If you stop and think about it, gas exchange is how we live. Without gas exchange, we'd all be dead. Gas exchange defining characteristics. There's ventilation, transport, perfusion, chest pain with breathing, cough, and shortness of breath. Some of the exemplars, I sort of divided them up because there were so many of them. Impaired ventilation, acute respiratory failure, adult respiratory distress syndrome, ARDS, airway obstruction, which happens a lot, asthma, atelectasis, chronic obstructive pulmonary disease, COPD, cystic fibrosis, infant respiratory distress syndrome, so that's IRDS, lung cancer, pleural effusion, pneumonia, pneumothorax, respiratory syncytial virus, RSV, which we see mainly in children, tuberculosis, which covers just about every age group that's out there, and then trauma or flail chest. Those are one of the big ones that especially you see in auto accidents these days. The other exemplars that are included are impaired perfusion and impaired transportation, aneurysm, heart failure, peripheral artery disease, pulmonary embolism, and shock. Those are impaired perfusion ones. Then there's the transport, the aplastic anemia, folic acid deficiency anemia. Just about any of the anemias are going to fit into this category. Megaloblastic, hemolytic, pernicious, and thalassemia. So those are ones that you would also want to look at and see what their crit is, and that could possibly be part of the reason why gas exchange is not doing well. Some of the related concepts, if you stop and think about it: gas exchange. If you don't have gas exchange, you're going to have an increase in anxiety. You're going to have an acid-base imbalance. Perfusion happens. Nutrition, mobility, fatigue. Those are also ones that you're going to see. Clinical nursing skills with gas exchange is assessment, oxygen administration, positioning or repositioning, using of the nebulizer, chest physiotherapy, especially for cystic fibrosis children or adults, airway suctioning, that's a huge thing that you need to know, and medication administration. Okay, that takes me to the end, and I will see you when I see you. Thanks.